Hello and welcome to today's Essential Together National Huddle. We're so pleased again to welcome patients, families, caregivers, and essential care partners who are joining us today. We're pleased to offer this session with simultaneous interpretation. If you would like to hear the voice of our interpreter today, please select French from the interpretation menu at the bottom of your screen. Please note that this session is being recorded and the recording will be available after the session on our website. If you have not yet done so, please take a moment now to respond to the poll question on your screen. Please scroll down to see all the questions in both English and French, and be sure to click Submit to send your responses to us. I would like to thank our producers, Gina Peck and Kelly Ripley, who are operating behind the scenes today and providing us with all of the technical support that we'll need. At Healthcare Excellence Canada, we recognize that we are still learning how to respectfully support reconciliation efforts and develop meaningful relationships in partnership with First Nations, Inuit, and Métis governments, organizations, and committees. As part of this journey, we strive to support cultural safety and humility in healthcare systems and enhance the capacity of health systems to meet the needs of First Nations, Inuit, and Métis. I would like to recognize that we are virtually gathering today from a variety of places across the country. I would also like to recognize that my home office is located on the unceded, unsurrendered Anishinaabe territory. The Anishinaabe have long been keepers and defenders of the Ottawa watershed and its tributaries. I feel so fortunate to live, work, and play on this land and appreciate the opportunity to gather here today. I know that many of you are joining us from across Turtle Island, and I invite you to take a moment to reflect upon the territory and its original inhabitants where you reside. If you're unfamiliar with what territory you're on and the history that has built and preceded it, Native Land Digital is a great resource. The link to this resource is provided in the chat. As I introduce our guest speakers, I'd ask that you please take a moment to introduce yourselves in the chat box and where you're joining us from today. Our speakers today are from Kingston Health Sciences Centre. Angela Morin has been partnering with healthcare professionals as a patient and family experience advisor at Kingston Health Sciences Centre, formerly Kingston General Hospital, since November 2011. In June 2019, she moved into a leadership role, helping to evolve and expand on KHSC's commitment to patient and family-centered care as the lead for patient and family-centered care. Angela is a core faculty member and steering committee member for the Canadian Foundation for Healthcare Improvements collaborative called Partnering with Patients and Families for Quality Improvement, as well as our work in Better Together, the E-Collaborative and campaign, and our Bridge to Home work on transitions. Angela believes partnering with patients and families in healthcare improvement results in innovative and more sustainable solutions that matter to patients and their families. Angela's personal experiences as a patient and in supporting a close friend through her breast cancer and end-of-life journey continues to motivate her to bring the patient and family perspective to all levels of healthcare. Anne O'Riordan, after a career in healthcare spanning 4 decades as an occupational therapist and an educator at Queen's University, Anne's personal experiences as a patient and caregiver led her to become a patient advisor at KHSC in 2017, a current member of its Patient Family Advisory Council, and also sits on the hospital's Virtual Health Steering Committee, Accreditation Task Force, and Mental Health Program Council, and is a patient partner in the Virtual Health Research Group based at Kingston General Hospital. At the community level, she sits on the Kingston, Frontenac, Lennox, and Addington Roadmap to Wellness Task Force and co-chairs its Family Engagement Working Group, and is part of the Community Council for Local Ontario Health Team, and is a patient partner with the Canada Health Infoway, and contributed to Digital Health Canada's Virtual Care Maturity Model and Virtual Care Certificate Program. She's a member of the Virtual Care Expert Advisory Group on Patient-Reported Experience Measures with the Canadian Institute for Health Information, and strives to be a positive agent for change within the healthcare system, encouraging healthcare providers to offer compassionate, responsive, accessible care, and caring in partnership with patients, caregivers, and family. Big breath. A little bit about Healthcare Excellence Canada. We are a newly amalgamated organization that brings together the Canadian Foundation for Healthcare Improvement and the Canadian Patient Safety Institute with a relentless focus on shaping a future where everyone in Canada has safe and high quality healthcare. What is essential together? It's an evidence-informed and responsive to the needs and priorities of patients, families, and caregivers, as well as organizations and those who deliver healthcare. Essential Together was developed to support the reintegration of essential care partners into health and care settings during and post-pandemic. Its implementation support of co-developed policy guidance for those who make policy, who implement policy, and those who experience and are impacted by policy, supports organizations to resume safely welcoming back essential care partners, and has three main audiences: policymakers, the implementers of policy, and those who are impacted. And we do this through the evidence reviews that we've pulled together, our evidence briefs, our policy guidance, these national huddles that you've joined today, resources and tools that are available on our website, as well as a pledge and change package for support. The foundational principles for Essential Together are the issues of family and caregiver presence as essential care partners. It's multi-jurisdictional, and there are similar concerns, challenges, and opportunities for policy conversations across the hospital sector, long-term care, and other congregate care settings. These foundational principles were co-developed as part of a 2020 collaborative policy lab process that included policy decision makers, health system leaders who implement policy, and the people who are impacted by policy decisions: providers, administrators, patients, families, and caregivers. This guidance was updated in 2021 based on evidence emerging through COVID-19. The Essential Together pledge and program fosters a community of organizations working together to strengthen patient and family-centered visitor policies within their own organizations, as well as throughout the sector. As a strategy to highlight organizations who have demonstrated a commitment to foundational principles, the Essential Together pledge was developed as a call to action and a way to recognize our partners as leaders in this area. In addition to access to the Essential Together resources and peer learning opportunities previously discussed, organizations that take the Essential Care Partner Pledge will be recognized as an Essential Care Partner champion that values the role of essential care partners, be publicly acknowledged on the AGC website and other materials as an Essential Care Partner champion that supports person and family-centered care practices, act as a peer mentor to other organizations committed to person and family-centered care practices, and have access to coaching support as they take action in their commitment to essential care partners. I'm so pleased to recognize our most recent pledging organizations: Forestdale Home in Alberta, Tideview Terrace in Nova Scotia, as well as St. Joseph's Healthcare Guelph and William Osler Health Systems in Ontario. And it is now my sincere pleasure to pass today's huddle over to Angela and Anne. Over to you both.
Thank you so much, Jessie. We're so happy to be here, and we're really looking forward to being able to share with you a little bit about the experience that we've had over the last couple of years at KHSC, and hearing about your experience as well. So today we're focusing on the foundational principle for Essential Together of ensuring patients, families, and caregivers have a voice in the development of policies, and how the patient experience advisors at Kingston Health Science Centre were engaged specifically in relation to changes to the family presence policy during the ongoing COVID-19 pandemic. We'll share how that engagement evolved, the impact that it had on family presence, and some lessons that we've learned about engagement in the time of COVID. We think that it's important, however, especially given that we have a mix of people on the line today, to provide some context to the setting and to share what our starting point looked like. What was the foundation that this engagement was built upon? Kingston Health Science Centre is Southeastern Ontario's complex, acute, and specialty care research and teaching hospital, consisting of our Hotel Dieu site, which is primarily outpatient and ambulatory clinics, Although through COVID, we did have some inpatient surgical beds opened there. Our Kingston General Health Hospital site, as well as the Cancer Center of Southeastern Ontario and a research institute. We care for more than 500,000 patients and their families from across the region. Our KGH site serves as the regional referral center for cardiac, stroke, renal, trauma, neurosurgery, pediatrics, neonatal, high-risk obstetrics, acute inpatient mental health, and cancer care. We're home to around 5,000 staff, more than 2,000 healthcare learners, and 1,000 volunteers, and 60 patient and family experience advisors. KGH, Hotel Dieu, and ultimately KHSC have been seen as patient and family-centered care exemplar organizations for over a decade. And we have commitment to the principles of patient and family-centered care, engagement of all levels of the organization, and it is embedded throughout. Next slide, please. Up until 2020, everything was being done all in person. We had, our advisors were not using virtual structures other than the occasional call-in or by phone or through email. We have 3 patient and family advisory councils. We have advisors engaged at all levels of the organization, participating on committees that make decisions that affect patient care, including things like program councils, the Interprofessional Practice Council. They're sitting on hiring panels, board committees, research projects. They're involved in quality improvement initiatives. They review patient-facing materials and education. They welcome new staff at the new employee welcome. They're everywhere. They were essential members to the organization. They were foundational to building the culture of patient family-centered care over the past decade. And KHSC has had an open family presence policy that welcomed and encouraged family presence in the care of their loved ones as a fundamental pillar of patient and family-centered care within our organization. And then came COVID. Anne?
So next slide, please. I want to share with you our story of setting the stage for patient advisor engagement relating to our family presence policy in particular, while preparing for the unknown of COVID-19. So please think back with me to 2 years ago, just about now, February 2020. Patient advisors initially heard about the hospital's COVID-19 concerns at a PFAC meeting, a Patient Family Advisory Council meeting, on February 24th. We were alerted to the potential seriousness of COVID spread and the need for a proactive plan by Elizabeth Barden, who is our PFAC executive sponsor and the hospital's Vice President of Mission and Strategy Engagement. Elizabeth was the conduit to the COVID Incident Command Group, which met daily to manage the hospital's strategy. A number of PFAC members, me included, volunteered to join a COVID working group. And Elizabeth and Angela strategically planned for a cross-section of advisor perspectives from pediatrics, mental health, the regional cancer and renal programs, and in consideration of vulnerabilities. The decision was made to hold the first meeting outside the hospital environment as lockdown was looming with an escalation of pandemic concerns and restricted access. On March 12th, we met at Balzac's, the photograph that you see on this slide, a downtown coffee shop with a quiet nook that offered some privacy. A clear introduction and overview of the current challenges regarding family presence were provided, with ample opportunity for expression of opinions, questions, and discussions. There was a congenial, relaxed, but very focused atmosphere in this meeting. Early preparation and proactive discussions provided the groundwork as COVID-19 evolved. We built the team collaboratively with a working together mindset, trust, and the mutual willingness to continue to engage with speed and sensitivity. We asked ourselves always, who must always have someone with them? When and how can we add a second person? How do we communicate between the unit or ward and the screening station at the hospital entrance? How do we keep people safe? How do we follow infection prevention and control requirements and comply with Ministry of Health directives? We examined family presence policies with an emphasis on transparency, communication, consultation, priorities, options and risks, flexibility, and expediency. We planned for discussions over the long term and agreed to respond quickly to asynchronous email correspondence, to meet in person or virtually as needed, and for whom this was possible. And I will tell you, as yet, we have yet to reunite in person as a group, as a working group. Everything has been done virtually. So I want to share with you what mattered most to me as a patient partner in this engagement. And first, it was the early involvement with clear, honest explanation of the project parameters and a proactive philosophy of engagement and collaboration. This happened while the threat of a lockdown was looming. Second was the transparency of the plans for policy review and consultation, with ongoing shared communication and feedback. And by this, I mean, we heard from leadership about their responsibilities and challenges in meeting provincial directives and balancing these with the desire and intention to support families and patients. Leadership also heard the heart-wrenching stories and examples that we had experienced personally and heard about through our connections with the patient and caregiver community. We emphasized the need for compassion. There were moments when tears were shed within this team, and there were regular updates and exchanges between leadership and patient advisors about the impact of our input and advice. And finally, the trust shown by the hospital leadership in sharing confidential information so we could be informed on the urgency and importance of our work. Personally, I found this experience to be enlightening as I listened to leadership struggles, both personal and professional, in managing this delicate balance. We gained a better understanding and mutual respect for one another as the leadership team navigated what were uncharted waters, and patient advisors continually raised patient and caregiver priorities. Our partnership was sought out, and our experience was relied upon in co-creating and adapting, not necessarily accepting, but adapting family presence policy and guidelines. I felt respected and heard at all times. And the impact of our collaborative work became apparent to us immediately and over time in several ways, which Angela will describe.
You know, I think it's important to remember that at the time that this was all going on, many of our patient advisors were also patients in the organization and sharing real-time experiences. In addition, patients and families that were present in the organization were bringing their concerns and suggestions forward through patient relations channels, through their healthcare team providers. And so often we would hear what their challenges were, what they were experiencing. And as patient advisors, we were able to give a perspective on how we might address some of those challenges. Things were raised like cell phone usage that wasn't usually permitted in mental health would create a barrier for being able to be connected to loved ones. And we needed to change that policy to make sure that they could be connected to their loved ones. We needed to look at the language we were using around visitors and essential visitors and restrict and identified registered visitors and care partners. And what did all of those things really mean? We looked at ways that if patients' family members couldn't be present, how were we supporting them in staying engaged? And we created a whole program called Staying Connected that had volunteers facilitating virtual visits with people who maybe weren't comfortable using that technology themselves. We sourced iPads to make sure everyone had the technology they needed to stay connected. We looked at developing essential partner programs and care partner programs and education and how to register visitors, how to do screening, how to look at exceptions when the policy didn't fit the situation. All of these things, right down to family members saying they wanted to send a gift and they couldn't send something in at that time, and the gift shop setting up a whole online order system so people could order from within the organization, tip sheets for family members who were coming into the organization, and all of the changes that were constantly happening around family presence because of the prevalence of COVID in our community, directives coming from the province. All of these initiatives included patient advisor consultation as they evolved and continually to this day are included in revisiting the policies and all of these programs. Next slide, please.
So all of us have had to adapt to a virtual world in one way or another, as we all know. And as patient advisors, we had to learn how to engage virtually in our volunteer commitments. Some of us found advantages to connecting virtually that were similar to people working from home: less commuting time, reduced anxiety about infection, an ability to reach beyond our own community. We also realized the challenges of learning new technologies, forming relationships in a virtual world, maintaining effective communication, and feeling the loss of personal touch and face-to-face contact. Connecting with the patient advisors group was a lifeline for many of us during lockdown. It gave us a sense of purpose and agency during the pandemic. We reflected on these experiences in addition to our patient and caregiver backgrounds as we continue to advise about family presence policy and also about direct patient and family contact. So we emphasized compassionate responses when faced with anger, fear, concern, and grief, reaching out to family and caregivers with regular updates when patients provided consent, being transparent about family presence guidelines and clear in how family could protect their loved ones and themselves, and creating new ways to connect and care for one another. I want to share one more story. I was asked to join one of our hospital-wide town hall virtual meetings to deliver a message from patient experience advisors last year. These virtual meetings give leadership the opportunity to share the most recent hospital updates, scientific evidence, and messages of hope and encouragement to all staff within the hospital. I shared my experience of being hospitalized for 1 week in December 2020 and the challenges I felt approaching and after major surgery. My message was meant to impart gratitude and convey ways in which staff could help patients at their most vulnerable and with limited family connection. The anesthesiologist offered comfort and human touch when I was frightened. My nurse talked to me about the approaching holiday, and we shared our disappointment at not being able to see family. A porter stopped me as I was walking in the hallway to ask if my poncho was from Ireland. A long conversation about hopes for future travel took my mind away from pain and motivated me to keep walking. These acts of compassion and connection helped to reduce my fear and isolation when my husband could not be with me. However, he was able to be at my bedside on alternate days, as per the family presence policy at that time. And we used those days to ensure my comfort, to communicate with staff about treatment options and discharge planning, and to focus on well-being. Next slide, please. So I can say that no one was happy about the limitations of family presence in our hospital, but the COVID working group ensured that the rationale for every change, whether it was limiting it or broadening family presence, was warranted, that patient priorities were highlighted, and communication to the public was transparent. It wasn't perfect, but we worked in partnership to create the conditions and elements of family presence to the fullest possible extent in our hospital. It happened because of the relationships that existed and were strengthened during the pandemic. The elements on this slide convey what I experienced and found crucial to the partnership. For me, much of the success in maintaining and expanding my volunteer commitments, along with my own personal sense of engagement and satisfaction, revolves around trust. Patient advisors informed the decision-making and had a voice at the table, but in the end, the decision makers were at the hospital leadership and ministry levels. Next slide, please.
These quotes on this slide were captured in our 2021 PFCC annual report. And I think they reflect the importance that the patient advisors, their role played over the course of the pandemic in helping to really ground some of the leadership decision making within the organization. What we found was that by hearing the patient voice in all of the decisions, that the compassion and the patient-centeredness was also part of the discussion, along with the challenges around infection prevention and control, provincial directives, and other things that were influencing the decision making. And because of that, we at no time, we always had certain groups that had family presence with them. At no time did we completely lock down and not have family presence. We had hundreds of registered visitors within the organization, but it would continue to change as situations evolved. So at sometimes there were real limitations on who could be with loved ones in the hospital. But there were still loved ones there at end of life. There were still loved ones there in pediatrics, in delivery, people who had cognitive issues had the support that they needed. And I truly believe that because of the patient voice at the table, those things were always front of mind into the decision making. Next slide, please. So, you know, it's been a fine balance during pandemic time. The patient experience advisors for sure have had challenges around access and figuring out technology and being supported in using technology and access to the intranet. And we are always looking at ways to make it easier for them to continue to be engaged meaningfully and purposefully. And so, you know, as we look to the future, we're looking at what does this look like coming out of COVID and how do we continue to keep them engaged? But all we know for sure is that we definitely hugely value and do consider them to be essential to the organization and to the decision making within the organization as we move forward. And they will continue to have a voice in the programs that we have that address family presence challenges. Next slide, please. So we're sharing some resources and references that we have identified. And I have to say that in even just thinking about what we're going to talk about today, it was a real challenge to whittle it down. So I'm looking forward to the conversation. Hope we can dive deeper on a couple of things. Next slide, please. And I really welcome you to connect with us if there's any resources or tools that we talk about today that you're interested in learning more about. I'm going to turn it back to you now, I think, Jesse, to moderate the discussion because I'm conscious of time. And thanks everybody for listening.
Thanks, Angela, and thank you, Anne, both, for sharing what has clearly been challenging and rewarding work over the last 2 years. As Angela mentioned, we invite you to share any questions or comments with Angela and Anne, and to share what you and your organization have been working toward and how it has navigated patient engagement over the last 2 years, and what your plans are going forward. Because you know, and so many organizations, so many teams have learned so much about what engagement looks like over these last 2 years and what it doesn't look like, and are working towards that. That's part of why you're with us on these Essential Together huddles. And so I'm just going to look to the chat box, and I see Esha has added a comment. Esha, do you want to come online and just ask Angela and Anne your question? Maybe I'm putting Esha on the spot. So
could you kindly read it out, because I put it so nicely and concisely there. Thank you.
Happy to do that. So Esha has written that OR's distinction between acceptance and adaptation is significant, particularly for both patients and family members who belong to ethno-culturally minority groups. In that context, although technically being permitted to visit patients as essential family members, both acceptance or adaptation continue to remain invisible and concerns typically dismissed as inappropriate. These are critical challenges, especially within the lens of our pluralist society. And so her fundamental question is, which patient and family advisors are you speaking about? And, you know, who are your patient advisors?
Thank you.
Thank you for the question, Esha. And I think one of the things that I would preface this with would be that I believe that we hear the perspectives of patients and families in many different ways within the organization. And so although we have many patient experience advisors who are helping to support our work, it is also informed by the patients and families using from our community that are using our services. So, so I would say that within various programs, we will see different perspectives coming through as well. And I think your point about which I hope I'm catching it correctly, and feel free to correct me if I'm wrong. But I think your point about, are we cognizant of the challenges of various groups and cultures and challenges of people within the organization that are using the services of the organization. And I think there's always room for improvement on those things. But I would say that there's a sensitivity to making sure that we are always thinking about everyone and not just some in addressing our needs. Anne, do you want to add to that?
The one thing I would add is that we had a very active and hardworking exceptions group. And I think it was so important, the work being done by that group. And I see that Patty, one of the members, is on the line today, so she may want to comment. But our exceptions group was a very small group, including a patient advisor and our hospital ethicist. And if a family felt that their needs were not met as far as family presence, they could escalate and request an exception be made. And it would be reviewed by this expert group to decide if that could be done under the restrictions of infection control and provincial directives. So I think that was another level that was very sensitive to family and caregiver issues and that responded quickly. They met on a daily basis and were quite proactive in trying to help people have access, or at least understand the rationale more clearly behind limited access. I hope that helps.
We also have within the organization the Anunu Patient Services that work with the Cree population from Northern Ontario. And they had a lot of input specifically into the needs that they would have having to come from that distance and coming into the hospital. So there was a lot of work that was done with that group in particular, as well as we have a Southeast Regional Cancer Indigenous guidance group that was providing input as well into the cancer program within the organization, and an addictions and detoxification center group that was working with certain populations as well to ensure their safe care during this time.
Thank you both. Question from Jessica, does your exceptions team still meet?
So it does still meet regularly. In fact, what we're finding recently, and again, Patty's on the team, so but what we have found is that as time goes on, our family presence policy has adapted a number of times, and I think that there sometimes when there is any kind of sort of confusion around whether somebody can be there, whether they fit the category that they can be present, and especially as we continue to open up the family presence, sometimes the exceptions committee gets asked about exceptions that they don't really need to be asking, that it's they actually are somebody that fit the qualifications and it really didn't need to go that way. But I think, you know, as people are busy and tired and want to make sure people can be present, we see a fair bit of activity with the exceptions group. So we're looking at that now. And as we look at the prevalence changing in the community, one of the considerations right now is that as a community, things may be looking up and you may be able to go sit in a restaurant with everybody and not show your vaccination passport. But in our hospital right now, we are overflowing. And we have significant challenges with capacity, and we have issues around staffing, like every other hospital across Canada, I think, right now. And so our world in the hospital doesn't necessarily reflect what we might be hearing from messaging in the community. And we need to be able to assess how we're going to deal with that and communicate that clearly with patients and families, as well as with staff. And so the exception committee is still in place at the moment.
Thanks, Angela. I have a question. I'm not seeing anything in the chat box right now, but I do have a question, if that's okay, if you'll indulge me. We have another minute or so. I want to get a sense of, what has been going on in terms of your thinking past COVID. Have you had a chance to do that yet? Is it still too soon? Do you feel like you've navigated this and you've learned, I'm sure, like all organizations, you've learned so much from this experience. We at AGC talk about how can we support organizations to kind of crisis proof their policies so that they're able to kind of slide up and down based on what's happening and what we've seen over the last 2 years. Do you feel like you're starting to move into that space, or is it still too soon?
It's not too soon. I think we have seen things that worked really well, and we have seen things that didn't work so well. And there are things that we really don't want to go away. And there are lessons that we've learned that we would like to pursue even more, that will support families to be partners in care. And so I think that as we come out of the crisis stage of all of this, we have some really great things that I think we want to continue to pursue. And so, I believe that the recognition of the huge value that family plays as partners in care, this experience really drove that home for staff who truly didn't like not having family members there. They want the family members to be there. And so I think that we have learned some lessons around that we will be able to carry forward for sure. Anne, do you want to comment on that?
I think for sure the virtual visiting program that we've instituted will continue beyond. And though it's called virtual visiting, really it's engaging. So there are family members who could visit their loved ones in hospital who wouldn't have been able to be there in person anyway. So I think that points out that there are ways to expand the engagement and make it more appropriate and useful. I have dreams of families being at the bedside during morning rounds via iPad if they happen to live across the country, but their mother, their loved one, is in hospital. And I think those are opportunities that we can take advantage of, having proven that they work and that they can be useful in the right context.
Thank you. That's a little bit of music to my ears. My in-laws live across the country in BC. And so, for us, we would fit into that category exactly. There are a couple of other comments and questions in the chat box. I'm going to move into sort of wrapping us up because we're getting close to time, but maybe I'll ask Angela and Anne if you wouldn't mind taking a minute to just look at the chat box and answering question from Diane. And then Mary Jane McNally, thank you so much for your comments about William Osler and how they'll be continuing their robust essential care partner program with orientation and ID badge, et cetera. So great to hear that what's a little bit about what's happening in different parts of the country. So let me just jump in here. So we have some upcoming huddles on March 16th. Please join us for committing to family presence during COVID-19, the experience from Alberta Health Services. Our following huddle will be on April 20th, and we're just working through confirming our speakers for that huddle. But we also welcome you, our audience, to let us know what you'd like to hear or see in the huddles. And, if you would like to share the work that you've been doing, certainly you've been with us, many of you, for the last 18 months, if not longer. And so we would really love to hear how your work is coming along. And if there are things that other parts of our sort of community, our ET community, can help you with, if you've got curious questions or things that you need to know. We've also added some huddles moving into through to June, and so we'll share those with you shortly, as well as the dates and times for those. I'd just like to take another minute as we wrap up the session to thank Anne and Angela for joining us today, the HEC staff and the team of interpreters who have made this happen behind the scenes. And of course, a thank you to you, our audience, for joining us today and always sharing your questions, your thoughts, and things that are going on within your organizations. We'll be emailing a list of additional resources, as well as linking to the recordings of today's session, which will be available on our pages, our web pages. And you're also welcome to reach out to the HEC Essential Together team. We ask that you take a minute to tell us about your experience. And so we've put up a small poll for you. If you could just make sure that you scroll down to the bottom and then click submit, that would be fantastic. And we use that information to improve our sessions, and hopefully they are doing what you need them to. If you're interested in learning more about Essential Together, please don't hesitate to reach out to us. And as always, we include a list of resources that we have curated at the end of each of our presentation. This concludes today's webinar, and we look forward to seeing you on March 16th. Thank you.